Hi, my name is Sharjeel Ahmad. I'm one of the infectious disease specialists working in Peoria. I'm an associate professor of medicine with the University of Illinois College of Medicine, Peoria. Today, I will be talking about the need to social distance and mask after vaccination for COVID. Why and how long do we need to do that? So we know that the COVID-19 vaccinations are effective at protecting you from getting sick. Based on what we know about COVID-19 vaccines, people who have been fully vaccinated can start to do some things that they had stopped doing because of the pandemic. We are still learning how vaccines will affect the spread of COVID-19, so there are still certain measures we'll have to take to prevent the spread of disease. So before we get into that, let's just talk about the few basics here. So how do you define people who've been fully vaccinated? So people who are considered fully vaccinated 2 weeks after the second dose in a 2-dose vaccine series, like the Pfizer or Moderna vaccine, or 2 weeks after a single dose vaccine like Johnson & Johnson's Janssen vaccine. If it's been less than 2 weeks since your shot, or if you still need to get your second shot, you're not fully protected. So till then, you have to keep taking all the prevention steps until you're fully vaccinated. So what has changed if you've been fully vaccinated? So a few things. Number one, if you've been fully vaccinated, which is 2 weeks after your last vaccine dose, you can gather indoors with fully vaccinated people without wearing a mask. Number two, if you've been fully vaccinated, you can gather indoors with unvaccinated people from one, and I repeat, one other household. For example, you have relatives, you're visiting relatives who are living together, and you can gather with them without mask, unless, of course, any of these people or anyone they live with are at increased risk for getting severe COVID-19 disease. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. So 3 things, again, you can go with unvaccinated individuals, no mask. If you're just visiting a single household, no mask unless there are people who are at risk for getting COVID disease. If you've been around somebody with COVID, again, you don't need to get tested or stay away. So what hasn't changed now, even if you've been vaccinated, is you still have to take all the necessary protective steps like social distancing, wearing a mask, staying at least 6 feet apart, avoiding crowds and poorly ventilated spaces if you are in public, if you're gathering with unvaccinated people from more than one household, or if you're visiting an unvaccinated person who is at increased risk for severe illness or death from COVID-19, or somebody who lives with somebody with these risk factors. You should still try to avoid medium or large size gatherings. You should still delay domestic and international travel. And if you do travel, just follow the CDC guidelines. You should still watch out for symptoms of COVID if you've been around somebody who's been sick. And then if you have symptoms of COVID, definitely you should get tested and stay home and away from others. And you will still need to follow guidance at your workplace. So why are we doing all this now, despite the vaccination? One, we are still learning a lot about how the vaccines work and how effective they are. We know that the COVID-19 vaccines are effective at preventing COVID-19 disease, especially severe illness and death. We are still learning how effective these vaccines are against all variants of the virus which cause COVID-19. Early data does show that vaccines may work against some variants, but it could be less effective against others. We also know that other prevention steps to help stop the spread of COVID-19 are still important, even as these vaccines are being distributed. We are still learning how well these vaccines prevent people from spreading the disease. And we are still learning how long these vaccines can protect people. So as more data comes along, as time goes by, we get to know more about this disease. CDC and other institutions will continue to update these recommendations for both vaccinated and unvaccinated people. So until we knew for sure about these questions, everyone, even people who've had their vaccines, should continue taking basic prevention steps when recommended. So in summary, if you're vaccinated, you can be around other vaccinated people without mask. If you're visiting a single household with people who are not vaccinated, you can still be around them without a mask unless there are people with risk factors. And then if you've been around somebody who has COVID-19, you do not need to stay away from others, that is quarantine yourself or get tested unless you have symptoms. So so those are the three exceptions. Everything else remains the same. You still continue the steps with social distancing, staying 6 feet apart when you're in public, large crowds, if you're around a large group of unvaccinated people from more than one household, avoid any unnecessary travel, and still continue to watch out for COVID-19 symptoms and still follow guidance at your workplace. Thank you so much.